So my name is Richard Masiskiya. I am a rheumatologist here at King's Daughter Medical Center. I graduated from Furman University as my undergrad in Greenville, South Carolina, and then I went to the Kirksville College of Osteopathic Medicine, which was the first DO school established in the United States. After that, I did the majority of my training in Birmingham, Alabama. I did my internship at the Baptist Health Systems there, and then I did a sports medicine fellowship at Andrews Sports Medicine, followed by a 2-year rheumatology fellowship at the University of Alabama, Birmingham. Interestingly, as an osteopathic physician, our background is very strong in musculoskeletal medicine, so I always had a desire to pursue something along those lines, and I did a sports medicine fellowship which even further propagated that. And what I felt was, as an internist and a sports medicine doctor, a great combination would be to go on and do a rheumatology fellowship and kind of complete that musculoskeletal circle, and have loved it ever since. The rheumatologists deal with inflammatory conditions. Some people know them as autoimmune diseases or possibly connective tissue diseases, but most commonly people think of arthritis, which is associated with pain in the joints. We also deal with muscle conditions, nerve conditions, skin conditions, anything that might be inflammatory within the body. The term autoimmune means that the body is basically, in a way, fighting itself. Our immune system is essentially there to fight off things from the outside, but oftentimes the body will kind of turn on itself and cause inflammation within itself, and that is usually what causes the pain or the symptoms that a patient may develop. The common types of arthritis that we see, everybody thinks of rheumatoid arthritis, which is a fairly common disease in the population, an inflammatory condition that affects the joints, but probably the most common type of arthritis is osteoarthritis, which is more of a degenerative or wear and tear type of arthritis. I also deal with diseases such as lupus, or a condition that causes dry eyes or dry mouth called Sjogren's syndrome. We deal with inflammation of blood vessels called vasculitis, and then we deal with muscle conditions called myopathy or myositis. Anything basically with itis on the end of it, which means inflammation, that's what we see. The demographics actually start at birth. There are pediatric rheumatologists, and for a while I did take care of children, but there are certain forms of arthritis that occur from about birth on. But for the adult, it can be anywhere from 18 to 108. Rheumatoid arthritis can span that entire spectrum. We do see certain populations where we have a higher cluster of patients who develop inflammatory diseases, but essentially anybody of the adult age can have an autoimmune disease. I was looking for a place in this almost twilight of my career where we did not have a strong rheumatology foothold, someplace where I could have an impact and serve a population that didn't have 6 or 7 rheumatologists around. I was very happy to interview with the people here, and everybody at King's Daughter has been just wonderful to me and my wife and my family, and we decided this was where we wanted to be.